Hello and welcome to tonight's webinar. I'm Dr. Tracy Steady Hardcastle, and we are here tonight to talk about a topic that is almost certainly affects someone that you know and certainly has been in the news pretty frequently lately, and that is autism. So autism can sometimes be talked about like it has one cause, one look, or one type of treatment, but science tells a very different story. There are between 800 and 1,000 genetic variants associated with autism spectrum disorder. It's not just, and it's also not just one thing, it is many overlapping biological and environmental processes that shape how the brain develops and functions. So with me tonight, I'm so fortunate to have Dr. Adelia Sapp. Dr. Sapp, welcome. Would you like to introduce yourself while everyone's filling out the poll, and then we'll get started with our session?
Sure, yeah, it's a pleasure to be here with you, Dr. Tracy. We had a great webinar last time, or at least I enjoyed it. I hope our audience did too. Super rainy, blustery day in Seattle, kind of the usual this time of year. I do primary care in Washington in the Seattle area with a naturopathic functional medicine approach. I see a lot of individuals with neurodiversity, some with ADHD, some with autism. That's both children and adults, as well as associated conditions. So I help people a lot with insomnia or anxiety or depression, other kind of symptom pictures that may or may not be associated with neurodiversity. So happy to share whatever I can.
Thank you so much. So it seems as though autism affects roughly 1 in 36 children in the US. And when I was preparing for this, I had seen someplace that it was like it was really, really high here, and that there was not a lot in the rest of the world. But then as I was digging into the research, it seems like that's not really true, that it is fairly prevalent in other places as well. Even if ours is slightly higher, it's not like it's only here and not anywhere else. So that was something that was, I didn't think that it was here, only here and nowhere else, but I did see that and was like, is that really true? So I was glad to kind of put that to rest. Um, but there's no single autism gene, just to be kind of clear about that. And so today we're going to talk about what we do and don't really know for sure about the complex situation that is the autism spectrum. So we're going to look at genetics, neurodevelopment, environment, and metabolic function, and how those things all interact, and what modern functional genomics can teach us about personalized care and support. So first, what I'd like to do is pull up the poll, so that we can see what our audience is thinking about all of this. So Vanny, oh, there we go. Perfect. Here are our poll results. So our first question was, what's your main reason for joining this webinar? And 38% said to learn about the biology of autism. A close behind that was 30% to understand treatment options. 19% said general interest, and 13% said to explore functional or genetic testing.
Okay.
Question two, what area? Oh, I just closed my poll window. There we go.
Okay.
Thank you so
Okay.
much.
There it is.
Which area are you most curious about? And 38% said treatments and lifestyle interventions, followed by 23% mitochondrial health and metabolism, 21% gut and microbiome connection, and 19% genetics and heritability. Question three, have you or someone you know undergone genetic testing for ASD? And 62% said no, and 26% said yes, and several people are considering it. And I think that you'll find by the end of this webinar that it might be a helpful tool. Um, Question four, which of the following have you most commonly heard about autism? 51% said vaccines cause autism, only 2% that autism is a childhood disorder that people outgrow. Nobody had heard only boys are autistic. 2% had heard if someone is verbal or independent, they're not really autistic. 15% autism means having intellectual disability, and 30% had never heard any of those things about autism in the past. So, question 5 is what would you most like to gain from this session? And 34% how diet or environment play a role, 26% how genetics influence autism, 25% how to personalize support, and those two things are related. 13% how to separate science from hype, and 2% other, and they're adding them to the chat. Do you
Okay.
see those in the chat, Dr. Sapp?
I see the poll questions, and in terms of the other questions, I don't see those yet. Do you see
Okay.
those?
I don't. So I just wanted to make sure
Okay.
that I wasn't missing anything. So,
Okay. You're
yeah.
not missing anything.
All right.
Okay.
So it seems like um, a lot of people were interested in um, genetic and environmental slash lifestyle things. So um, since this is the DNA company, why
Yeah.
don't we start with genes? When you think about or when you're treating patients who might be having this diagnosis or adjacent diagnoses, what genes and or pathways or systems are you thinking about, Dr. Sapp?
Definitely. So methylation is the first one that comes to mind. In the functional medicine community, a lot of people bring up MTHFR. That is one of the SNPs in a methylation panel that has been associated with autism or other kinds of symptom pictures like anxiety or neural inflammation or rigidity in thinking that is associated. Um, SHMT1, I know we were talking about that gene before. It affects our folate metabolism. So there's been a lot in the media, and this is also part of that methylation panel, just to be clear. So that's definitely one section we think of. And your methylation of your folate absorption is affected by SHMT1. I have a double suboptimal, so that would be associated with being neurodiverse, among other things. Also, our detox capacity. So the whole detox panel has some association. GSTM1 having a null on that, there was some association with autism. GSTP1 as well, although it wasn't clear with that one exactly which variant. But if you have a single heterozygous suboptimal um, or double, that may be associated. Um, and then GSTT1 also may have some association. So definitely our detox capacity, and there's a lot that you can do for that. Um, that would be associated, and mitochondrial function. That's actually huge because the areas of the body that take up a lot of mitochondrial energy, and we learn in high school the mitochondria is the powerhouse of the cell. We've all kind of heard that. Well, what area of the body takes up a huge amount of energy, like maybe 30%? I don't know if you have an exact figure. It's our brain. So if you can't get enough mitochondrial energy in the brain, that's going to affect the wiring, affect your thinking, affect some of the kind of nuance or flexibility in thinking that is often affected by autism spectrum. So mitochondrial energy is a big one. And in terms of the genes for that, we have the SOD2, and I also have a suboptimal in that. You can take ubiquinol and L-carnitine, and there's a mitochondrial formula that I believe it's a great formula by the DNA company. Do you know if that one's still being distributed?
Yeah.
I love that one. Okay. And then there was the GPX gene too, which affects mitochondrial function. Um, so those are three of the categories that I would look at of genes, including specific ones. And then there was also the gut. Now, the diet and metabolism report may play into that. I don't know if there was a specific gene in that section of the report that you saw was associated.
Yeah, FUT2
Okay. Yeah.
was one that because it can, in addition to affecting how vitamin B12 is absorbed or whether or not it can be, depending on the genetics,
Yeah.
that it also can affect the mucosal barrier
Okay.
and the sort of the microbiome as a whole. And so this is where, and for those of you who don't have the app yet, I just want to make a little plug for the app because as Dr. Sapp and I are bouncing back and forth between reports, and you're
Hmm.
scrambling to keep up with us as we do that, the app is a really good way to switch back and forth pretty quickly. Um, but winding myself back before I was saying that, and I totally lost it. I totally lost my train.
No worries. I actually was going to continue because I definitely can't miss vitamin D metabolism. So I know that lower vitamin D is associated with an increase in autism symptoms. And that's something I just test for in terms of serum. I don't know if the specific genes affecting vitamin D metabolism are associated, but low vitamin D is. So in the Pacific Northwest, in this area, I always test vitamin D. So checking your D metabolism through genetics, through a report is great. And then checking your blood in terms of where you're at right now, especially during the winter, is a really good idea for our fellow Canadians. Also, super important. But I would say that across climates in North America, it's good to check it. So, yeah.
100%. Um, so in light of the fact that all of those things and probably more can affect whether or not and to what degree someone has symptoms or is suffering as a result of this diagnosis, um, would would you say that it's possible to pin down one thing as a root cause of autism?
Not really, no. So autism, as we know, is very multifactorial. So there is, like we said, there's about 1,000 or more genes that we know of that can be associated. So there is sort of a genetic base. There is a high level of heritability. Um, but we are also seeing epigenetic changes. So basically, genes take thousands of years to change, right? Like evolution takes thousands of years. However, there are epigenetic changes from generation to generation. So even if your grandmother or your mother didn't have a certain variation, we are starting to see more of those variations. I would call them variations as opposed to mutations because there's often pros and cons to different variations. So that's one thing. We have the genes, we have the epigenetics, and then we have toxic exposures. So, like we said, cigarette smoke, there was some association for women who are pregnant who smoke. That was a minor factor. Even glyphosate. So, in our wheat, some pesticides were associated. But I would say overall toxic burden, it's safe to say, is associated. So that is one of many factors, as well as maternal stress. I mean, that's huge nowadays. Women are potentially under more pressure to do it all than they have been in history. I know there's always debates here, right? But there's a lot of pressure on women. I think we can all agree. So even maternal stress can be a factor. And then you add to that, let's say viruses, and you get a neuroimmune reaction when you're pregnant, and then a stress reaction, and then some toxic exposures. And it really is so multifactorial that I think it's really important for no one to blame themselves if they have someone in their family. Because, first of all, the research is ongoing. Second of all, there are some real strengths associated with being on the spectrum. So, it all depends on the case, but we're looking at immune factors, toxicant factors, genetic factors, epigenetic factors.
Absolutely.
Yeah.
And even after someone is born, some of these things can come into play.
Yeah.
One of the studies that I was reading said that um, usually there is an illness with an associated fever just
Hmm.
prior to there being this developmental regression, which is one of the signs. And while that doesn't always happen, um, neuroinflammation and immune dysregulation can be part of the development and or how um, strong the symptoms are. So one of the things that I really wanted to drive home is that, like you were saying, there are some strengths
Yeah.
um, that are inherent in being on this spectrum, but how much someone is suffering as a result of it can a lot of times be changed by epigenetic things that we talk about all the time, like keeping the immune system in good shape, keeping our vitamin D levels strong, helping the detox pathways, eating nourishing foods. Some people genetically have a lot harder time with heavy metals. So a
Yeah.
heavy metal exposure for that person can create a completely different scenario from someone else. And once again, this is where these GST genes can come into play. Um, and the gut, which is such a place where we have some ability to really take charge in a way. And there were definitely some specific um, parts of the gut microbiome that were more deficient, that tended to be more deficient in people who had autism than other people. And when they looked at them side by side with family members, that was a really interesting piece of it because it was like, okay, well, if the family member has the same gut microbiome, and they are not on the spectrum, what is the reason for it? And it did
Hmm.
come down to I think we have 38 to 61% of the same DNA as a sibling with two same parents, right? So there can be
Hmm.
a lot of genetic variation even between
Right.
siblings who are living full time in the same home.
Right.
So it's a combination. But then if someone had a different microbiome, then they also responded differently, even with more similar genetics. So it's this back and forth flow of cause and effect that I think sometimes treating the side symptoms like
Yeah.
anxiety and the gut microbiome and doing all those things through genetics, through all of the other functional medicine tools that you have, Dr.
Yeah.
Sapp, and that any of
Yeah.
us have,
Yeah.
can actually help the autism itself
Yeah.
in terms of its effect, right? Without
Right.
taking away the gifts, just
Hmm.
taking away some of the struggle. And
Right.
going to school or work with a really bad stomach ache, how can you perform? Not that performing necessarily
Yeah.
is
The
is
goal.
everyone's life goal, but how can
Yeah.
you show up fully presently? I guess would be the way that I would phrase it. Um, if you have a really bad stomach ache, like
Yeah. Yeah.
or a
Absolutely.
terrible headache if you're getting migraines all the time. So irrespective of whether or not what's causing the headache is also causing autism, treating the symptom can make everything feel a little bit better.
Yes, yeah, absolutely. And I want to get into some more examples of that. That's a really good point. But I did want to acknowledge Sheila's comment. So we are going to save the last half hour at 4 p.m. Pacific for questions, but we're open to audience engagement. So if anything comes to mind, just pop it in the chat. We might save it for later. But Sheila was just saying that she had her son's genome sequenced, and um, she was told that nothing was pointing to autism. But when she did the DNA code 360 and went to work with her son's genes, his quality of life made it 360. So that's a pretty cool anecdote. Because a clinical geneticist might not find the specific genes that they're looking for. But if we see that someone has like a really suboptimal detox panel and they have really suboptimal methylation, so they might need B vitamins that can't quench inflammation effectively, we can assume that that might be a factor that might kind of optimize their biology and reduce those associated symptoms. So, anyways, that's a great anecdote, Sheila, and I'm really glad to hear that. Um, that kind of leads me to what I often work on with patients, which is usually the associated symptoms. So there is some degree in some people of reversibility for something like ADHD. For depression, which is often associated with neural inflammation, there's some degree of reversibility. With autism, there's less. That doesn't mean it's impossible, but we can take someone who may still be on the spectrum and we can reduce their neural inflammation, improve their social skills, improve their sleep, improve their anxiety. So just thinking of some patients I've worked with, one autism may have been worsened by mold toxicity in the Pacific Northwest. I see that a lot more often than I would like to because it's so wet here. A lot of the buildings will like hold mycotoxins. So that is a whole other rabbit hole, but it does relate to detox. Another patient had really bad insomnia, so we were working on that. Another had anxiety and ADHD, so we were able to work on that while we optimized their biology. So if we do a DNA test, if we do blood tests, we can see some of the factors that are worsening their condition, and then we can improve quality of life while not taking away the strengths associated with autism spectrum. And I know I want to be sensitive about that because I know it really depends on where the person is at on the spectrum. We can't deny that there's a huge amount of pain for them and their loved ones if they are less functional. But we also don't want to disregard that some people on the spectrum have incredible gifts that we wouldn't want to take away. So that is kind of my take on treatment.
And one of the things, and probably anyone who is a parent of someone on the autism spectrum disorder spectrum uh, knows, but that someone on this webinar who doesn't know someone super personally, who is they're just here out of general interest, might not know, is that it might be likely best when doing interventions. Let's say you were going to start a supplement, make a dietary change based on a gut microbiome test, and institute some sort of behavioral therapy, that throwing too many changes at once at someone may not feel great to them. And so go having a more gentle approach instead of looking at someone as a problem to solve, instead thinking, how can I help them feel more comfortable? How can I help them be happier with their life, and with being in various situations, right? And
Mhm.
that there isn't it's not a race to get someplace. It's more of a journey to toward helping. So just if you leave this webinar and you know someone who has a child with autism, um, I wouldn't necessarily say, I've been to this webinar and you need to do these 5 things all at once, like because the parent is probably going to look at you like, I can't do all of those things. That's overwhelming to me, let alone to my child. So I just wanted to kind of put that out there, that some sensitivity can be required when it comes to treatment in these situations. Uh,
Definitely. Yeah, agreed. For some of my younger patients, especially, or less functional neurodiverse patients, they'll have like a parent or a partner come in with them, and that can be, helpful in terms of integrating plans. But I have also noticed that some, and we can't really generalize about things like this, but some of my neurodiverse patients who are on the spectrum prefer to do one thing at a time. So going slow, but also recognizing that it does not manifest the same way for everyone, not even close. You can't tell all the time, especially in women. They've shown that often females, younger females, tend to mask more. That's just a common behavioral compensation. Um, but whether it's leading to learning difficulties or insomnia or social troubles or how it manifests is different for every person. So I look at that particular person's results, their lab results, their struggles, instead of looking at them as the condition. Because there is no box, at least in functional medicine, that says this is the treatment. There is no one treatment. So it really is tailored to the specific person. Let's say we know they have suboptimal folate genes, SHMT1. We could test their blood, and we could, if they're kind of low range or suboptimal or below the range, we could administer folinic acid. And that's one that like has come out in the media, high dose folic acid. Um, it needs to cross the blood-brain barrier. But that has shown, some autistic individuals have shown improvement. We can test their B12 as well as looking at their methylation report. And we can recommend that if they're lower. So what the specific factor is, the ideal is to start with a genetic test and then work with a practitioner that can make those recommendations tailored to that specific person. So,
Which, by the way, I haven't seen studies that have done side by side, giving folinic acid to people with one SHMT1, MTHFR, you know, presentation versus another. And so whenever we're presented with statistics, um, remembering that it's that looking at an individual is different than looking at a statistic. And so
absolutely.
I'm hoping
Yeah.
that we're going to get to a place where some of these studies are done on people with different genotypes and different
Yeah.
combinations, because once again, we're not looking at one gene. We're not saying if you have MTHFR, you need to do this, or even if you have SHMT1, there's also, then you have to look at COMT, right? So if
Mhm.
things are better in one area, not better, if they're faster in one area, or you're better able to methylate, but then you've got a wicked slow COMT, you can
Mhm.
still end up having someone feel more anxious. And if anxiety is already a piece of their picture, then you don't want to be over methylating them. But
Yeah.
then, but for some people, they might feel a lot better if they are taking the methylated form. So it really, really depends on the person and on their whole DNA 360 report in terms of methylation. What is the best thing to do? That said, if one has a suboptimal FUT2,
Mhm.
um, and you're not able to absorb vitamin B12, no matter what type you're taking
Yeah.
in your gut as well,
Yeah.
then using a lozenge is going to be the better way. So that's one place where we're sort of like, it's only
Yeah.
one gene and it doesn't tell the whole story. I'm not going to tell you which form of it to do, but you're going to
Yeah.
want to make sure it's a lozenge. So.
Yeah, or an injection if you can get one,
Right,
right? Yeah.
right, right.
Yeah.
Which not everyone, not that's not even like a part of some people's area reality where they live geographically.
Yeah.
But yeah,
It's
that can be another definitely. And people can feel very different after an injection because they don't have to process it at all.
yeah.
It just goes in. So
Yeah.
and the GI symptoms in children who are on the spectrum are 4.4 times more prevalent than in um, quote unquote neurotypical children.
Right.
Um, and so the gut microbiome is a huge factor in all of this. And the gut 360 is a really good test. And just seeing what can be done instead of feeling, I think sometimes it's really possible to feel pretty powerless when faced with the overwhelm of um, the challenges that can present themselves. And so
Yeah.
having tools that can point in a direction instead of, you know, every social media group, everybody giving you different information and trying to sort through it yourself, or even having four different doctors tell you something, that like having something in front of you that says, these are my genes that I came in with, this is what my microbiome is doing right now, and then
Yeah.
and using those as a starting space um for lack of a better term, experimentation.
Yeah.
You know,
Yeah.
like
Yeah.
really good, like really good, well, not just like throwing spaghetti at the wall, but saying, okay, this is my tendency. What happens
Yeah.
if I do this? Right?
Yes. Educated guesses, which is actually a component of functional medicine, because basically we can use data to help guide us. But someone's response might not be exactly correlated, but there's a pretty good chance, given, let's say your blueprint is saying you have poor absorption of B12, you're probably going to have poor absorption of B12. Um, so we use the data to help guide us, but there still is an element of experimentation. So something like low dose naltrexone, which can affect neural inflammation. So that term gets thrown around a lot. It manifests in lots of different ways. But if someone's brain and spinal cord and nerves are prone to inflammation, some people much more than others, it can affect something like depression. It can make one person depressed if they're neurally inflamed. The next person, it can increase symptoms of ADHD. The next person, symptoms of autism. So we always have to get that clinical picture, as opposed to just, we can't just look at someone's genetic report and their labs and know them. Although Dr. Mansour arguably was pretty good at that. But the same gene can manifest differently depending on who we're dealing with. LDN is an example of something that might be an experiment with your doctor. So some children with autism have responded incredibly well to that, others less so. Same thing goes for leucovorin. You know, it came out in the media, but high dose folinic acid is not necessarily a game changer for every child with autism. It would be really interesting to see those studies. Um, Somebody brought up PEA. That one can help neural inflammation. I don't know about the studies on autism. I loved that when I had long COVID. It was a game changer for brain fog. So for those of you out there with brain fog, it might be worth a try. For autism, even, I don't have research on that, but that's another thing that might be worth experimenting with, particularly under the guidance of a doctor, a functional doctor, preferably. Someone who's willing to look at your labs and talk about treatment options. Um, so where were we? Tracy, you have to keep me on track there. Speaking of neural inflammation. Yeah.
You're just
We have a
excited.
lot of
It's not
questions, so that's
neuroinflammation. Yeah.
good. I'm just
Um,
excited.
that is exciting. Yeah, and it's an exciting topic
Yeah.
because we haven't really talked about that here before, and it's definitely something that's very present in society right now. So it's kind of an exciting thing to be talking about, especially given, sweeping statements that might happen, like that this is the one cause or this is the one solution. Knowing that
Yeah.
there is more nuance to it than that is definitely an important thing to be aware of.
Yeah.
So um, so we've covered the gut thing. We've covered um, the methylation, we've covered glutathionization. I do want to talk a little bit more about mitochondrial dysfunction
Yeah,
because
me too.
that was something that seemed to be really pretty prevalent in terms of uh, one of the things that I read was that 30 to 50% of individuals with this diagnosis demonstrate biomarkers of mitochondrial dysfunction. And
Yeah.
so, really protecting the mitochondria, knowing. So, let's talk a little bit about the SOD GPX interaction
Hmm.
because it's together. They can have a different effect. You can be suboptimal in one, not suboptimal in the other, and depending on the mixture of these things, end up with different kinds of inflammatory markers. So
Yeah.
if you're SOD, um, if you're lower in this enzyme,
Hmm.
then you may end up with more oxidants. You don't have as many ways to break them down. And so someone might think, oh, well, then I need to just throw a whole bunch of antioxidants at this, but then they haven't looked at their GPX speed. And
Yeah.
so if the GPX speed doesn't match and you're trying to fix the SOD2, you can end up with a bunch of peroxide in your system that the
Hmm.
that the antioxidants are actually making that part of it worse. So someone might not feel better. They might say, "Well, I have this SOD2 that isn't working great, and
Yeah.
and so I'm trying to do something for myself to make it feel better, but instead they're not feeling well." Do you have any thoughts or experience with any of that? Any thoughts about mitochondrial health and how you might handle this in this population?
Yeah, yeah. So mitochondrial health, as we mentioned, definitely comes up as a really big factor in the etiology and biology of autism because we need our brains to have that mitochondrial energy. If your SOD2 is suboptimal, like you got heterozygous, or you had both of the genes suboptimal, will likely have less catalytic metabolic activity. So you'll have less cellular energy, or at least that's what you'll be prone to. So supplementing with some ingredients, like some of the ones we listed before, glutathione is the big one at the end of the day that your body needs, but not everyone, depending on that combination, responds well to oral or IV glutathione. So I don't know if you, Dr. Tracy, have any insight on that combination, who might not respond well to IV glutathione.
Well, if someone is a double null
Mm-hmm.
for in their GST family,
Mm-hmm.
then if they have zero copy number variations in that family, they may respond fairly poorly to a lot of glutathione supplementation, and an IV
Mm-hmm.
is a sort of a big intervention.
Yeah.
So
Mm-hmm.
I would now there is definitely a place for IV glutathione therapy for sure,
Yeah.
but someone might want to take a look at their genes, and also if they haven't ever used it before, see how they do with the oral before going straight into an IV therapy, just to see
Yeah.
how they feel. But people can really feel worse. It can because it can end up in the wrong place.
Mm-hmm.
So these things act in different places. And so if you're trying to get it into the cell and
Yeah.
instead it's hanging out outside of the cell,
Mm-hmm.
um, you can have an effect where you feel not great and you're not actually having the effect that you want to have. So then taking the precursors to glutathione can
Yeah.
be a better move because it's more gentle and works with the system that you have
Yeah.
instead of with the system that you don't have. And it doesn't
Yeah.
mean that you can't feel good. It's just that
Yeah.
you have to handle things in a slightly different way. And
Mm-hmm.
some people have two copy number variations for I'm speaking of the two genes where copy number variations are a thing as opposed to
Yeah.
SNPs. Um, they
And
have
those are,
four, and they
mm-hmm.
can have it can be overactive and they can end up with psoriasis and things like that. And so then do you want to add glutathione to that picture or not? Right. So it really is dependent on the person and what's happening for them.
Yeah,
Any
agreed. Yeah. And so one of the lowest risk ones that you could try is NAC, right? If you take a lower dose, which is like about 600 milligrams of NAC, because you can go up to the gram dosing, like multiple grams, you can start with that. Then most forms of liposomal glutathione are well tolerated, especially at the lower doses. But some people, if they have that particular sensitivity, might not even be able to handle that. So that would be where you would only dose occasionally. If you handle the liposomal glutathione well, then you could consider IV glutathione. And a lot of people respond really well to IV glutathione. So it all depends on the person. I know I love IV glutathione. I feel amazing afterwards. I mean, even better than a lot of supplements. But one of the supplements Tracy had mentioned for sure is the Mito Optimizer. The DNA code Mito Optimizer is great. So it gives you ubiquinol, which is like the more active version of CoQ10. And then that one has, can you list off the ingredients for that one? Because I've taken that. I was on it for like 2 years, so you would think I would know. Because I also
You
have,
and I look at so many things every day that
yeah, yeah.
that memorizing everything that's in a
No worries. I
supplement
shouldn't put
is,
you on the spot
oh
like
no, it's
that.
okay, because I can look it up while you keep talking. That's no
Yeah.
problem.
That's a great one. I mean, the first day I took that, I felt a difference. Not everybody responds like that to supplements, just for the record. So I don't want to sell anyone on it unnecessarily. LDN, Tracy had asked about that. It stands for low dose naltrexone. So naltrexone is actually used in higher doses, like 50 milligrams and higher, for addiction. But in really low doses, like 1 to 4 or 5 milligrams, it's used to increase good neurotransmitters and to decrease neural inflammation. So it actually has a pretty different mechanism at the low doses than it does at the high doses. The high doses were kind of blunting a dopamine response somewhat, but the low doses were actually increasing neurotransmitters and decreasing brain inflammation. So people respond differently, but it's often a question of starting low and working with a functional practitioner and seeing if that helps you. Someone mentioned
And
they
it can,
prescribe it for MS, and there's so many applications for that. So if anyone's interested, there's a nonprofit based out of the UK called LDN Trust. And they have really good information on LDN. So yeah.
yeah,
Um,
100%. Yeah. And they
yeah.
have books and everything, as well as just articles right on that website. So I
Yeah.
did find our mitochondrial optimizer,
Okay.
and it has manganese,
Right.
tocotrienols,
Right.
which is a lot better for some people than other
Straight
forms of vitamin
vitamin
E.
E. Agreed.
Ubiquinol, which, as Dr. Sapp mentioned, is CoQ10, but it's able to be utilized and it's active. And then PQQ, which
Hmm.
is which with CoQ10 is a really good combination, both for cardiovascular health and for mitochondrial health. So
Yeah, and for that one, cognitive, like you might notice if you're really sensitive to supplements and you're having suboptimal mitochondrial function, you might notice a kind of a light. I felt a light bulb turn on. I'm really like selling this one, not intentionally, but I don't make a profit off it, just to clarify. But yeah, I think a lot of us now, especially post-COVID, could really use a mitochondrial boost. So it's not just those with neurodiversity. There's like a huge energy problem, I would say, in the US, even globally. So like mitochondrial health is worth it for most people to work on. So someone was asking if it ships to Australia. I'm thinking it does. I don't know if you have an answer. They
I
have
do
been
not
able
have an
to,
answer.
unless it gets stopped at customs, but we have been shipping. Yeah. so to Australia. So,
Yeah, I
yeah, other than that, like for these last 10 minutes before we try to kind of address some of our audience questions, and audience, feel free to put anything in the chat that you are dying to know about, that you're really curious
The Q&A,
about.
put it in the Q&A in
Q&A,
the, yeah,
sorry,
not the, it
the
gets a little
regular chat.
confusing because we have multiple places to put it. We
Right,
might miss it
okay.
in the chat, but if you put it in the Q&A, we'll definitely see it.
Yeah. So there were also the executive function profile. We didn't mention that. So there are some genes in there that are associated with autism, but they're also associated with a lot of other manifestations. So we should probably say that ahead of time. So COMT, COMT, is associated with, if you have it fast, you tend to break down neurotransmitters faster, as well as estrogens and certain toxicants, so toxins. So that can affect things. People who have slower COMT, that gene alone would make you a little more prone to anxiety, um, OCD tendencies or rigidity, or trouble with context switching or task switching. I don't think we talked about this, Dr. Tracy. Did we both have that one? Anyways, I'm not
Yeah, I
gonna
have a
talk
slow
about
compt.
so do I. So do
Yep,
I. So there we go. Um, we're allowed to share our own genes. We don't share anyone else's, but you know.
exactly.
Yeah. So then there's the dopamine one, DRD2. I also have a suboptimal with that one. I don't know if it's the low dope. Usually the low is considered the suboptimal. So I would assume that it's the lower that might be associated, but that's TBD. Um, and the serotonin 5-HTT-LPR variant could be associated. So as well as BDNF. So there's a lot of ways it can play out, but looking at the executive profile can give you some clues as to how to approach it in the specific individual as opposed to treating the condition. So if they
And
have, yeah, go on.
go ahead. No, I just wanted to
Go.
also add ADRA2B to
Mm,
that because if someone doesn't clear their stress hormones, especially if for instance they have a slow COMT um, and deletions in ADRA2B,
yeah,
then they may stay in that fight or flight place for a little bit longer. And how this can manifest would be if um, something, you know, triggered a what I don't know how to say this, a feeling of a lack of safety
hmm,
in someone, it may take longer to get them to a place of feeling safe again, as opposed to someone else. And so when people are dealing with people who no matter where they fall on any neurotypical to not neurotypical thing, this can be a part of that. And so just understanding that someone may recover from a stressor a lot more
hmm,
quickly than another. And it doesn't mean
yeah,
that that one person is better. It
yeah,
just means that physiologically they can't flush out the chemicals as
yeah,
quickly as another person, and just
yeah,
having some tolerance around that. And likewise, if you know somebody who clears things out really fast, it doesn't mean that they don't care or that
yeah.
that they don't feel things as deeply. Their chemicals just go away. So,
Yeah, yeah, they move on quicker on average. But
yep,
they may also hit their breaking point quicker because they don't get those cues. So, right, we talked about
right.
that in our last webinar. But yeah, that would be another example of one that has some positives and some negatives. Also, I had that suboptimal ADRA 2B, right? And the positive with that one is sometimes those individuals, there's an association with increased emotional sensitivity and even increased empathy. So there's pros and cons. That's why we call them variations, not mutations. Um, but having that one, some people on the spectrum have higher empathy than neurotypicals. And so they may be, empathizing and feeling even more than someone else. It might be sometimes harder to read depending on the person, but it doesn't mean that that empathy and understanding isn't there. Um, so that's an interesting one as well. In terms of like lifestyle and overall, suggestions, where would you start? I have my own thoughts, but if you were an audience member who themselves, let's say they had a late life diagnosis, that's happening more now. People in their 30s, 40s, 50s are realizing they have autism. I've had patients who've gone through a lifetime of milder traumas that, compound to now they say I have PTSD because I've been misunderstood my whole life. I didn't even understand myself. Where would you start if you yourself was struggling with something autism related or someone you love was struggling? Tracy.
Well, I think that starting with that self-compassion and understanding, and then having that be the base of everything else, right? So if you know that you've been called high maintenance because you need certain things to be a certain way, instead just kind of accepting, okay, well, this is how I make my life work for me, instead of how I make myself try to fit into a box that isn't made for me, right? I
Yeah.
think that that's a really, I know that that's not probably what everyone's hoping to hear, but I think that on an emotional level, understanding that, and then I think that figuring out, based on other symptoms, do you have any other symptoms? Do you
Mhm.
have digestive issues? Do you get headaches? Do you have anxiety? Um, are there other things that go along with it, and picking one of those and diving into that area would be a really good thing. And I have a thing about the gut. So if you don't have any other
Totally.
symptoms, I would
Yeah.
I would probably obviously get your genetics done, but then I would go straight into the gut 360 and just see what's going on there, see if you can be better utilizing your fuel.
Hmm.
If you can be making, because that's the other thing about mitochondrial dysfunction, is that if things aren't being processed and certain things made, uh, butyrate and things like that in the gut, you don't feel as much energy. Your cells can't be as well fed. So I think that the gut is the next place that I would start and figure out what foods are optimal and suboptimal for you, what you're high and low in terms of your microbiome, and try and get that into a place of better balance.
That makes sense. That was a really good answer, Dr. Tracy, as usual. Um, yeah, so so I always talk to my patients, and I'm sounding like a broken record about the biopsychosocial model. Um, in all health issues, it applies really, but especially when it comes to cognitive health and mental health, it definitely applies. So you want to take care of the biology, and that's kind of where I come in, where you come in, where a lot of the testing, like the DNA co-report, would come in. The psycho would be, let's say you could benefit from occupational therapy or a neurodiversity informed talk therapist. And I have had some patients who are neurodiverse who worked with some talk therapists who weren't necessarily neurodiverse informed, and then it didn't work for them. So talk therapy can be very beneficial depending on the approach and depending on whether that practitioner is versed in that area and understanding. And then social is, I have a patient that got a tremendous amount of benefit psychologically out of being part of a Zoom meetup with other late diagnosed autistic individuals. And that is probably the main thing that they're doing for their condition. Now we're working on anxiety and blood sugar, metabolic health, sleep issues. Those are common associated symptoms, but they probably had the most benefit just out of being involved in that group. So biopsychosocial. So finding other people that get you, whether they're people who identify as neurodiverse or not, whether it's connecting more with your family, slowly stepping out of your comfort zone, making like social contacts that can all be beneficial, or even doing social skills training. That's part of like as um, a what is it called? A basic standard of care. I forget the term because as a naturopathic doctor, we don't always go exactly by standard of care. We have more options. So standard of care. So social skills training can be helpful for that. But yeah, I would just make sure you're addressing kind of all three of those. Your psychological life, your social life, and that includes your job and your family and socioeconomic and all these things that can be stressors. That's also part of your treatment. So getting people in your court, getting people that understand, and in terms of the biology, working with a functional doctor or holistic nutritionist or MD who has a focus on mental health and cognitive health and neurodiversity. And then, of course, testing can be beneficial. I know when I got it's very useful to get certain blood tests like vitamin D, B12 and folate. You want to make sure you're in general good health, like a CBC and CMP. There's several labs, your homocysteine, which is representative of often how your methylation's working. And then your DNA report is kind of your blueprint and your genes don't change. So personally, I saw a huge amount of benefit from getting my genes tested. I think you could probably attest to that as well, Dr. Tracy, since you were telling me about how you discovered DNA Co. And yeah. So anyways,
Yes.
yeah.
Yes. By getting my testing done. That's how
Right.
I ended up here.
Right, right.
Yeah.
Yeah, it was incredibly enlightening when I got mine done too. So biopsychosocial, that is kind of a lot, but there's different ways you could approach it. First, you could find the healthcare practitioner and optimize your biology, or you could just start with a genetic test, the DNA co being one that covers a lot of ground. So that's kind of how I would start.
Awesome. Thank you so much.
Cool. No problem. So we have some questions
Yep.
for the
Yes, we
next
do, which is great.
5 minutes.
All
Um,
right.
so one question was, is Asperger's a part of the autism spectrum? So it is, although it's not currently called that. So I think Tracy is answering that one, or you just removed it. Okay.
No, I
Okay.
just was making it clear that we were answering it live.
Oh,
Sorry.
okay, okay, great.
That's how I stay
Yeah,
organized.
yeah, no, that's great. So yeah, it's now instead of being called Asperger's in terms of like a diagnosis, it's just called autism, but you would be probably lower on the spectrum because now they're including the whole spectrum. Whether you have like developmental delays or need help in day-to-day functioning or have Asperger's and are high functioning, it's all autism. So what used to be called Asperger's would now just be considered lower on the autism spectrum. And the diagnosis code is the same for all of them. So yeah. The next one, I mean, can you list those genes so I can check against my raw data? Sorry, that was so fast. So I guess I can type this answer as I'm going, right? So I can list some of the genes here. So it is more sections of the report than specific genes, but some of them are at the methylation section, SHMT1 was one, um, MTHFR. I don't know if you're a quicker typer, Tracy, or someone is able to type this at the same time. Um, Multitasking. So most of the genes in the methylation section would be applicable, but especially SHMT1, both of the MTHFRs and FUT2. So that whole methylation section is relevant. Um, Then for your mitochondrial function, the SOD2. So your mitochondrial activity is one that's relevant, and your mitochondrial function in general is relevant. Um, and then your detox capacity is definitely relevant. So three of the genes we had quoted, and GSTP1 is kind of inconclusive which variation is most associated, but GSTT1, null, so that means no copies was associated. And then GSTM1 in some capacity, if you have a suboptimal variation, was associated. Then there's a number of combinations for the executive profile, but BDNF, which affects your neuroplasticity, ADRA2B, COMT, basically every gene in that cognitive and executive function profile could be associated. So it can kind of guide you in your treatment plan and supplements plan, depending on which of those is suboptimal. And then your vitamin D metabolism. So which gene did we have here, Tracy, in terms of our vitamin
Well,
D
we have
metabolism?
three. We have
Yeah.
VDR, um, which is always the first one that I think of, and
Yeah.
then I
There's
forget the other two,
three
even though.
genes for vitamin D metabolism. So it's not that
Yeah,
those specific genes were associated, so we don't necessarily have
right,
that evidence, but we do know that lower vitamin D, there's some association. So looking at your vitamin D genes would be
right.
helpful.
Yeah,
And then because the way you metabolize certain foods affects your gut, some of those diet and metabolism genes would be useful. So whether you are more prone to a lactase deficiency could be useful. There tends to be more food sensitivities in those on the spectrum. So looking at that diet and metabolism would also be useful. Were there any others that you wanted to bring up, Tracy?
I don't think so. I think you
Okay.
covered all the ones you said
Okay.
FUT2, right? Yeah,
Oh, actually, I didn't add that though to the list here. So Emily, I actually typed out part of it, but not every single one. So you want to look at methylation, mitochondrial function, your executive profile, diet and metabolism. Hormones, less so, but there is a 4-to-1 ratio of men to women. But your specific hormone report, whether you're estrogen dominant or androgen dominant, we don't really have information on that unless you do, Tracy. But we do know it's more common in men,
right.
in males.
And that's not I don't
Yeah.
think that that's 100% clear
Hmm.
why that's the case. So,
Right.
all right.
Okay. Is there one that you wanted to tackle?
So we've got, can mitochondrial support supplements be sprinkled on food? It is so difficult to get my kiddo to swallow a tablet. So you're wondering, could you like grind it up and put it in a smoothie or something? I think that's the question. And I don't think that there's anything in there that couldn't be, they're not like time release. There are some kinds of CoQ10 and things like that that are time release, and anything that's time release, you wouldn't want to do that. But I don't see a problem with that. Do you, Dr. Sapp?
No, yeah, no, that could absolutely be done. Yeah, open up the capsules. Or you could even get some of the ingredients separately in powder form. But yeah, definitely opening up the capsules and sprinkling it. I've had a number of neurodiverse kids, I mean, kids in general that like are really picky about how they consume things. So yeah, it's often, as long as it's a supplement safe for kids. And a lot of those mitochondrial ingredients are safe. It's just a question of dose. So yeah, that sounds like a good adaptation for sure. One of our audience members asked about GSTM1, having a kiddo who's got kiddo's gut who expresses GSTM0. So I don't know, Dr. Tracy, do you know if that relates to to the Gut 360 report? Because I have the info on GSTM1 null, like what can help
Right.
with that, but not specifically on how it affects the gut.
Yeah, I would think of that in terms of detoxification and keeping, not wanting things to build up in the blood and
Mm-hmm.
therefore not wanting things to build up in the gut. So keeping the
Mm-hmm.
gut moving so that things aren't getting reabsorbed. There's nothing in the Gut 360 about GSTM1
Okay.
specifically.
Mm-hmm.
But if I'm thinking about like those two tests and
Yeah.
wanting to make there are certain kinds of bacteria that will increase a kind of enzyme that brings things back into the body, which can be good for vitamin D, but bad for something else. And so it's like
Yeah.
just making sure that the gut is not moving too fast, which can also be a
Mm-hmm.
problem
Yeah.
with kids who are on the spectrum. There can be either constipation or diarrhea or just a lot of pain.
Yeah. Yeah.
Or they could be asymptomatic, but just still not have um, an ideal ratio of different kinds of bacteria. So in if you know that the person also has a no copies of GSTM1, just helping in general with detox and with flow.
Yeah. Yeah, absolutely. Yeah, that's what I would say. One herb that I find is really well tolerated in general is milk thistle. And I know you can get like milk thistle gummies. You want to look out for sugar content, but sometimes that can make it easier for your kid to take it if it is a high quality company. I think Gaia, which is like one of those companies that does like professional, but then
Mhm.
also is more widely distributed, has them. You have to be really careful with orders from Amazon, I will say, because it depends who the distributor is. There are tons of counterfeits in the US right now. So you have to be careful of your sources for supplements. But yeah, milk thistle, there's some kid-friendly versions available. Um, making sure your kid is having daily bowel movements. It could be 2 to 3 if they're solid bowel movements a day. One of the easiest ways is giving them magnesium citrate, making sure they're hydrated and making sure they're active, up to tolerance. So just ensuring regular bowel movements so that they're not reabsorbing those toxins and they're not, we don't have them sitting in the gut for days, is important. And then hydration would be important for detox. Giving them magnesium baths too can really help. And it's even better if you rinse off after those, but magnesium baths or castor oil packs. So this is an old school naturopathic trick where you get a piece of fabric and you put castor oil on it, and you can get pre-made ones online, and you put it over the liver, or when the kid has tummy issues or a sore stomach, you can put it just over the abdomen overnight with a heating pad for half an hour. So that's an old school trick that tends to help detox. So basically you're also just looking to have less additives in their food and just lower their overall toxic burden. Because when you're lacking the GST-M1 and the GST-T1, your toxic bucket overflows more easily. So you just need that extra support. So good question. Um, the next
And I
one,
think we have one about folinic acid, right?
yeah, yeah. So I could get on my soapbox about this one. So basically, I've seen a lot of reactions in sensitive individuals. So especially those who have neurodiversity or some form of mental health concern, that some people don't react as well to the methylated forms. And this can relate to your methylation panel for sure. If I haven't seen someone's genes though, and they've expressed sensitivity to supplements, medications, foods, different life factors, and they're also neurodiverse, I tend to err on the side of caution and dose with the non-methylated B12 and folate. So the folinic is much better tolerated. If your methylation cycle is not functioning efficiently, sometimes, and this does depend on a few of the genes, those methyl groups can stagnate in the cycle. And then they can lead to certain things like agitation, headaches, anxiety. Those are just some of the common manifestations of over-methylating. So there is a small percentage of the population that could react negatively to the methylfolate, particularly oral, if it's continuous dosing and it's building up in the system. So I often start with folinic, and then when it comes to the B12, I'll often start with adenosine or hydroxy, just in case they're one of those people. I also happen to be one of those people. So when you've lived it yourself and you've seen it in patients, you err on the side of caution. But yeah, that's part of my answer. I don't know if you have anything else to add to that. I think that one
Um,
crosses the blood-brain barrier more easily.
Yeah, it
Yeah.
might, because I think it's less reliant on the rest of the pathway being able to
Mm-hmm.
receive. So what my understanding is that taking the methylated version, that if there aren't enough receptors,
Mm-hmm.
that it's especially this is specific to brain, right? And
Mm-hmm.
so the brain and the cerebrospinal fluid
Mm-hmm.
were places where people in this subgroup didn't have enough folate, where there was like an overall folate deficiency. And so they
Yeah.
wanted to supplement with this because I think it was just less complicated, right? So when we're
Mm-hmm.
looking at everyone's genes, we can see the entire pathway. We can see if everything's good up until COMT, or if they've got
Right.
other things that are mismatched in terms of speed and ability to methylate versus not methylate or absorb.
Yeah.
So we have more information. When people are running testing, they don't necessarily have those genes in front of them, right? And like you were saying, sometimes you know your
I
patient's
often
genes and
don't
sometimes you
in
don't.
practice.
And
Yeah.
so you want to go with the more cautious approach
Yeah.
where it has a better chance of being absorbed under all conditions.
Yeah.
That's not to say that someone who had a certain genetic presentation wouldn't benefit more from the
Yeah.
methylated version. It's just that if you don't know, it's probably better to do it a certain way, right?
That makes sense. Yeah. And as a caveat, I have seen less negative reactions to the methylcobalamin, if we're talking about B12 injections, than oral methylcobalamin continuously. I
Interesting.
If anyone knows that exact mechanism, feel free to let me know. I've been trying to figure it out for a while. Moving on. Alrighty, so after grains from supplements with functional medicine guidance, do supplements need to be taken for life since there are underlying genetic issues affecting symptoms and characteristics? So some of them, a lot of them can be pulsed and cyclical because it really depends on the category of vitamin. Let's say we're talking about vitamin D, which is kind of one of the most basic ones. You might not want to be taking that for life because you could get to a certain point where you're well over the reference range. So that one depends on how much you need at that specific point in time. So you might just take vitamin D for 3 to 6 months. And then because you don't live in Seattle, you're getting enough maintenance for a while, and then you retest again in 6 months. Um, and then a lot of other supplements can be pulsed where you take them cyclically. So let's say we're talking about adaptogens like, ashwagandha or ginseng. You want to vary them or take breaks from them. Um, for iron, someone might get to the point where their gut function has improved and they're absorbing it better. And because they took supplements or they had iron IVs, they don't have to take it anymore. So a lot of them can be taken cyclically, like for a couple of months to a couple of years, and then not. But then there's certain ones like if you live in a region that has less sun and you don't absorb vitamin D well, you might be taking that long term. Fish oil, if it's a quality fish oil and it's really beneficial to your mental health, you might be taking that long term. Magnesium's one that can be a long-term supplement. So there's a couple of exceptions where you would take them long term, but generally it's like in the months to years range. I don't know if you would agree with that. And it's really hard to generalize because it depends on the supplement.
Right. It depends
Yeah.
on the supplement, it
Yeah.
depends on the genes affected. And
Yeah.
so it's, yeah, I 100% agree.
Yeah,
Yeah.
something like B complex, that's another example of one that might be cyclical. You might be taking more of those in a period of high stress, and then you may take a break from them. Um, and your blood levels might normalize also, so then you don't need them anymore. So yeah, there's a couple of them you might want to take long term, but it varies. Right.
All right. So our next question is what kind of gut test? So I was talking about the Gut 360 um premium, which is our gut test. Um, Next we have one, and I'm talking a little bit faster just because I don't want to run out of time before we get to the rest of these. We got a bunch of questions, which is awesome. We love audience participation. My son is an extremely picky eater. He is unwilling to try new foods. How can I incorporate more fruits and vegetables in his diet? Would you like to go first, or would you like me to go first?
No, yeah, you go. Yeah.
Okay. One of the things that I used to do with my stepchildren was make them really small, not the children, the vegetables.
Mm,
So like I would take the food processor and I would make kale like um, more like what you would see as a garnish, but then I would throw an entire thing of that into some soup and they would just be like eating the broth and not really noticing the vegetable in there. Or incorporating it into other things and not to like hide it, but just like
mm,
let's mix this up. Like there are these meatballs that have zucchini in them, and then they're getting more
right,
fiber, but the meat and the seasonings and the feta sauce on top of it kind of mask the fact that it's vegetables.
right.
There are some powders that I like. Some kids might not like the consistency of the powder, but if you can find something like yogurt or something else that they like it in, I like Rainbow Vibrance by Vibrant
Mm,
Health because it doesn't
mm,
have like a ton of adaptogenic herbs in it, quite frankly.
right.
It's just
Mhm.
food. And so you don't have to worry that you're giving additional supplements to your kid that they may or may not respond well to. It's literally 100% food. And I have even consumed it like with some hot water and had it like a tea.
Yeah.
So that's,
Wow.
or it can go in a protein shake or something like that. Dr. Sapp?
Yeah. Such a good stepmom. Wow. They're lucky to have you. So microdoses of vegetables snuck in your food. No, I'm just kidding. Um, but yes, throwing in a greens powder, like a quality one. So, if you don't know the distributor, not necessarily off Amazon, but if you get it at a good supplement store, let's say, a greens powder in a smoothie, that's a good one. So it's one way to hide it in. You might be able to. Some of them are more palatable, and like some kids have different, texture issues than others. But yeah, I like the hiding it in other foods thing. I think my mom used to do that for my sisters. They were really picky eaters. And the greens powder, some of them taste pretty good. I really like the Ancient Nutrition greens powder. It does have some mushrooms and I don't know about adaptogens, but the greens are a really good blend with lots of antioxidants. But there's a lot of good ones on the market. Um, and then yeah, yeah. I don't know. You can also call them different things, right? Like, my mom used to call egg rolls fairy rolls, or just like give them like special names. Sometimes you change the branding of the food. For some kids that works. It worked on my sister. So, anyways, those were some ideas. I did have a question from Shira. She wasn't in the Q&A, but she got this in our chat also. So there was some blood testing. I did say vitamin D, B12, and folate, a CBC instead of a CBC, and a CMP, and then homocysteine. So those were some of the blood tests that I would ask your doctor for either the person who is on the spectrum in your family or just for yourself for optimizing your biology. Those are all ones that are good to test, I would say. Um, and then a not good feeling from glutathione. This was a question from Christine. What is the not good feeling from glutathione outside the cell building up? So I would say that it's more like I don't know if you would be able to describe it, Dr. Tracy, but like the suboptimal feeling, is it kind of like a Hertz reaction? Like,
Yeah, that's what I was
yeah.
going to say, is that
Mm-hmm.
someone might think that it's like a detox reaction, like a
Mm-hmm.
Herxheimer
Mm-hmm.
reaction, but then it just keeps going on and on and on. So
Mm.
it's and may not get better. And um, so it may
It
not be like,
eventually it'll get better, right? But just it might last longer than we want if it's IV, right? Is that
oh,
what you meant?
I didn't mean from the same dose. I meant like if you
Oh,
continue
okay.
to take it,
Right,
like
right,
if you're
right. I
like, oh, I
got
want
it.
to take
Okay.
this for the next 10 years,
Yeah,
you may end up feeling suboptimally if
yeah.
you with continued use. I didn't mean from
Got
like
it.
one IV or one dose.
Got
I
it,
just
got it.
meant,
I was like,
sorry.
ooh.
No, I wasn't clear. I wasn't clear.
No, no worries. Yeah, so it's kind of like a feverish feeling if we're talking about that, right? It could be like you feel more inflamed, you kind of feel like the early stages of a virus, but it's not that. Like you just have an overall inflamed or headachy or sore kind of feeling, right? So it's something like that, but everybody kind of responds differently, even to head colds, you know? So some people, for me, the first sign is brain fog. Other people, it's a headache. So it's kind of along those lines,
Mhm.
usually. Let's see. So Nancy said, would someone with slow comp have more difficulty responding to supplements that increase neurotransmitters? I'm thinking of dopamine. So, yeah, so if you have slow COMT and you were taking, let's say, L-tyrosine that increases dopamine, there would be more of a chance that you would actually respond to it. So you may get more of a dopamine response than someone with fast COMT. But there also might be more of a risk that your dopamine converts to norepinephrine and gives you anxiety. So you may be more likely to also get the side effects from increasing neurotransmitters. So if you have slow comp, you might just have to be more careful about your dosing and your titration upwards, I would say. But you can still technically have a low dopamine binding and slow COMT, although it's not as common. But yeah, it could make you more sensitive to those supplements, both the good and the bad. So that would be my answer. All
I just
right.
want to put it out there that we are going to run out of time before we get to everyone's questions. And so
Okay.
my goal is going to be that we try to answer them. I know that there's a way that we communicate them, and it might be that we post them under the YouTube, but I don't know
Mhm.
if I'm right about that because this is my first webinar where I've had to answer questions after
Yeah,
the
we
fact.
have a
But
lot of questions today. I do believe there's a way we can communicate them. I don't know if there's anyone from the host and panelists, so I would love to take all the time today. We are unfortunately going to have to wrap up, but we can take all of these questions and get you guys answers. I believe also that it would be posted under the YouTube video once that's put up, and that should be put up shortly. I don't know if that's within the next day or the next week, typically. I would say within the next week, but correct me if I'm wrong, anyone from the host and panelists. And we can take those questions and post the answers underneath the video. Um,
okay. So the replay for the session will be available on our YouTube channel as soon as our team is able to upload. Be sure to subscribe and turn on notifications so you don't miss it. And then there's a link in the chat. So, and Dr. Sapp and I are learning something new tonight, which is how to do that. Um, so
And Angela said also on the Facebook page.
oh,
So
see,
if you can,
that is all technical beyond my beyond my capacity.
yeah,
So
so thank you so much, Angela. So the remaining questions we are going to try to answer and post on the Facebook page as well as underneath the YouTube video. So, Dr. Tracy, how does that sound to you?
I don't know for sure about the Facebook page.
Okay.
But however it usually gets to you, that's how it will get to you again. I'm just gonna say it.
Okay.
Dr. Sapp,
All
thank
right.
you so, so much. It is, I need to get you on here as regularly as regularly as I
I
can. I know
would
you're
love
so
that.
busy, but I have so much, it's great to work with you. So thank you so much for
Thanks.
all of your wisdom and expertise and clarity around all of these things. Audience, thank you so much for joining us this evening and for all of your wonderful questions. And I hope that all of you have a wonderful, for me, it's evening. For the rest of you, it might be afternoon. Enjoy the rest of your day.
Yeah, thank you so much, Dr. Tracy. It really is a pleasure working with you. I love our conversations here. Thank you so much for the audience. You guys asked such great questions and really made us think and kind of dissect and everything. So thank you to the DNA Co team for helping us out. Thank you to everyone whose question we didn't get to yet for your patience. And I hope you all have a wonderful evening and look forward to connecting with you in the coming weeks again on another webinar. All right. Have a great night, everyone.
Bye.
All right. Bye-bye.